So back in the 1950s, HRT came on the scene. Now, hormone replacement therapy is actually thousands of years old. There's actually documentation that goes way back into China, where they used to collect the urine from youthful men and women, and then the emperors and empresses, or whatever they were, would somehow ingest the urine. They would dry the urine and then they would ingest it. So this
Probably
has been
drink
going
it.
on for a while. Yeah, delicious.
I'm thinking from a glass. They just drank it. We're not going to recommend that for those of you listening. We're not recommending that, but go ahead.
So in the 1950s, they made Premarin, which was from pregnant horses' urine. Again, urine. And so that was the first kind of on the scene estrogen replacement therapy, and it was taken orally. And this became the #1 most prescribed medication in North America. And it remained there for a very long time. So you can imagine every woman was on it. Like, it was highly sought after. And they realized as they, the years went on, that they needed to create something that would mimic progesterone. They didn't get this from horses. They made this in a lab. It was a synthetic chemical, which we still have around today in birth control pills as well as hormone replacement therapy. And that was Provera, also known as progestins. And the frustrating thing is if you start to look through PubMed research, you'll see progesterone, the word progesterone, being used in a lot of research when it was actually progestins that were used in that research.
Yeah, interesting.
Yes. And so the progestin had to come in because they needed something to counterbalance the growth in the uterine lining, because without a progesterone in there, the uterine lining, because of the estrogen, and estrogen's a growth hormone, would grow the uterine lining and it would become uncontrolled growth. And then there was an increased risk of uterine cancer. So they're like, okay, let's put this into the mix. So they did that. That was also taken orally. In the late 1990s, the Women's Health Initiative came onto the scene. This was one of the biggest studies of its kind. There was over 600,000 women. They set out to say, let's prove that hormone replacement therapy is of benefit. And so they set out to do this research, and with all these women, and they started the study. They had a couple different arms of the study, of course. One being both the Premarin and the progestin. One arm of the study of just estrogen, the Premarin. We can't even really call it estrogen. Horse's estrogen, we'll call it.
Horse's estrogen.
Which is nothing like our own, you guys.
No, right. So silly. But yeah.
it worked. It worked to get rid of symptoms. And then, so they had the arm of the study where women didn't have a uterus. So they didn't use the progestin. They just used the Premarin. And so in this, and I'm telling you all of this because this is what leads into the use of bioidentical hormones. And this is where a lot of the misinformation comes from.
Yeah.
And so these study went on for a couple of years. And then in 2002, they actually stopped the study. This was about 4 years into it. They stopped the study because they saw that there was an increased risk of heart attack and stroke, uterine cancer, and breast cancer. Now, this, when they reanalyzed this study, it showed that there was an extra 1 woman in every 1,000 that developed breast cancer from taking the combination of progestin and Premarin. So, but we didn't hear about this. All the world heard was, oh my gosh, get women off of hormones, hormone replacement therapy. It's killing them. It's giving them breast cancer and uterine cancer. Stop.
Yeah. And can I say something on that? Because I think this is really important when we look at science. Science studies are multifaceted. When you look at a study, you got to look at the sample size. You got to look at the parameters in which they studied the people. You've got to look at the backing behind the people. And even once you've looked at all of that, there are often little things that get highlighted and pulled out that now become this like flashy statement. And this still happens to this day in studies. And we need more rich conversations like this one to talk about what was going on in that study. I mean, we have this in the fasting world all the time. This is right, this is wrong. No, there's a lot to unpack here. Now let's unpack it. So I just have to make sure that I say that. That was really well stated.
Absolutely. Yes. And you can when you start to actually dig into the research, there's been so so many people that have reanalyzed the study, and it's shocking what the truth was of this study and how nobody still to this day is talking about it.
Right.
It was, and you can ask a woman still I get it all day long, every single day in my practice, where you tell a woman like, hey, maybe you could use some estrogen replacement therapy. And they're like, they just like cover their breasts. It's like,
right.
What?
Yeah.
Like, I'm going to get
power
breast cancer.
Of media. Power of media. It's crazy. Yeah,
and
so
doctors
crazy.
too. You'll go to your doctor and the doctor will say like, oh, I'm not going to give you estrogen. That will kill you. They literally will say that will give you breast cancer. When they looked at the study later on, there was so many faults to it. There was like, they couldn't find any women that weren't on Premarin. So they ended up with women that were unhealthy, over the age of 60, well past the 10-year window of being in menopause, all of the things. But what was shocking about it was the arm of the study that used the progestin that had the increased risk of breast cancer. In the arm of the study where just the Premarin was used, horse's estrogen, there was a 33% reduction in breast cancer cases, which once again, when you look at it from like the overall view of how many women, et cetera, it was still small what the difference was of how many women didn't get cancer and then the ones that did in the progestin group. But still, that's why you got to look at these studies. Like you were saying, like you really have to dig into that research.
Yeah.
So we didn't hear anything about this. And still to this day, how many, like 20 years later, we still think that estrogen is going to give us breast cancer. And so 80% of women stopped using their hormone replacement therapy and really started to suffer because of it. And then eventually we started to see what was now known as bioidentical hormone replacement therapy, which is made from either from soy or from yams. Now, these are chemically made still in a lab, but that is where they're derived from. And they are identical. So you can think of them as body identical hormones. The chemical structure is exactly the same as your own. And we typically, like with the estrogen, we really, even though there is bioidentical oral estrogen, I always say you use it topically because the reason why there was an increased risk of heart attack and stroke with the Premarin was when you swallow estrogen, it can increase the risk of stroke. But if you look at the research, there is no increased risk of stroke and heart attack when you use transdermal through the skin estradiol. So that's a huge distinction to make.
Okay, now before you go any further, because I have, full transparency, I've tried bioidenticals, I've tried HRT, I test everything on myself. And I've tried every cream on the planet. And I will tell you that the creams did not work for me. And now I'm doing a bioidentical pill, small dose of progesterone at night. And I'm doing some little troche of estradiol, estrogen sort of combo, and it's finally worked. So are you telling me even if it's bioidentical that increases risk? Because otherwise I don't have a solution for me.
Okay. Have you tried injection of estrogen?
I haven't. That
So
would scare the shit out of me if you're going to inject me with that. You're going to inject, I'm on such little amounts of these hormones. It's just, I've worked so much on my lifestyle and I finally, progesterone, I just want to point out for everybody, progesterone, I think is the real needle mover for menopause. That's been my personal feeling. That's in what I've seen after looking at literally hundreds of thousands of hormone tests that have come through our platform, that I think progesterone is one of the biggest needle movers. But then when we go to put the creams on, it's a whole different game.
Yes. So sometimes people won't absorb the creams very well. It's really is about finding what delivery form is going to work best for you and also what type of hormone therapy are you going to do. There's several types. There's static dosing. A lot of doctors will do every single day and they'll do of progesterone as well as every single day of Bias, which is a combination of estradiol and estriol. There's 3 kinds of estrogen. There's estrone, estradiol, and estriol. Estrone is the more inflammatory of the 3 estrogens. It sits 100% on what is called the alpha receptor, the estrogen, the E1 alpha receptor. So There's alpha, there's beta, there's other ones, but those are the two main ones. We produce estrone out of our fat cells, and estrone can convert down to estradiol, and estradiol can convert over to estrone. So they go back and forth. And then the two of them can also convert down into estriol, which is the weakest of the three, and that only binds to the beta receptor. And so the doctors will oftentimes mix estradiol and the estriol together because estradiol will bind 50% to the alpha, 50% to the beta. So they'll put in the estriol because it only sits on the beta receptor, and the beta receptor isn't proliferative. The alpha is. So the estrone is the one that's linked more to breast cancer because it can be proliferative. So it doesn't cause it, but if you have breast cancer cells, it can make it go there and grow. When we swallow estrogen of any kind, so it sounds like you're on a bias troche. So we end up swallowing
I'm on a troche, yeah.
Yeah. So we end up still swallowing about 40 to 50% of troches, even though they're sitting in the, like, obviously, right? We're going to swallow some of that. When you swallow estradiol, it has to go through the first hepatic pass of the liver, and then it will be converted to estrone, the stronger of the ones. Now, that said, remember, it can still convert down into estradiol throughout the system, proliferate, like, inside the body, not through the liver, inside the body. So when you swallow it, you're going to be getting a lot of estrone, which is the more inflammatory one that is not the one that is our primary hormone. So estradiol is like the mother of all hormones in our body. It is I think it's the most important one because of its far-reaching effects on our health.